Welcome everyone. Now I will discuss on infantile colic. Infantile colic is a frequent, prolonged and intense crying or fussiness in a healthy infant. Colic can be particularly frustrating for parents because the baby's distress occurs for no apparent reason and no amount of counseling seems to bring any relief. The episodes often occur in the evening when parents themselves are often tired. Episodes of colic usually peak when an infant is about 6 weeks old and decline significantly after 3 to 4 months of age. While the excessive crying will resolve with time, managing colic adds significant stress to caring for your newborn child. When we see some symptoms of infantile colic, overall the definition is infantile colic is defined as crying for 3 or more hours a day, 3 or more days a week, for 3 or more weeks for no apparent reason. Features of colic might include intense crying that may seem more like screaming or an expression of pain, crying for no apparent reason, unlike crying to express hunger or the need for a diaper change, extreme fussiness even after crying has diminished. Predictable timing, with episodes often occurring in the evening. Facial discoloring, such as skin flashing or blushing. Body tension, such as pulled up or stiffened legs, stiffened arms, clenched fists, arched back, or tense abdomen. Sometimes there is relief in symptoms after the infant passes a gas or as a bowel movement. Because gas is likely the result of swallowed air during prolonged crying, it is not thought to be the cause. The cause of colic is unknown. It may result from numerous contributing factors. The possible contributing factors that have been explored include digestive system that isn't fully developed, imbalance of healthy bacteria in the digestive tract, food allergies or intolerances, overfeeding, underfeeding or infrequent burping, early form of childhood migraine, and family stress or anxiety. Colic does not cause short-term or long-term medical problems for a child. However, colic is stressful for parents. There is increased risk of postpartum depression in mothers, and early cessation of breastfeeding can happen due to prolonged crying. Feeling of guilty, exhaustion, helplessness, or anger might appear in the family, and shaken baby syndrome might occur. Shaken baby syndrome is the condition that occurs when trying to calm a baby that is crying. The stress of calming a crying baby has sometimes prompted parents to shake or otherwise harm their child. Shaking a baby can cause serious damage to the brain and the death. When we came to treatment, the primary goals are to soothe the child as much as possible with a variety of interventions and ensure that parents have the support they need to cope. Soothing strategies include using a pacifier, taking your infant for a car ride or a walk in a stroller, walking around with or rocking your baby, swaddling your baby in a blanket, and also giving your baby a warm bath, rubbing your infant's tummy or placing your baby on the tummy for a back rub, playing an audio of heartbeats or quiet, soothing sounds, and also providing white noise by running a white noise machine, a vacuum cleaner, or a clothes dryer in a nearby room, dimming the lights and limiting other visual stimulations. In addition, we should have to modify our feeding practices. Bottle feed your baby in upright position and burp frequently during and after feeding. And try change in a diet for both the mother and the baby. If a baby is formula feeding, if you feed your infant a formula, try 1 week trial of an extensive hydroxylate formula that has proteins breakdown into smaller sizes. And if you are breastfeeding, you may try a diet without common food allergens such as dairy, eggs, nuts, and wheat. You may also try eliminating potential irritating foods such as cabbage onions, or caffeinated beverage. Regarding parent self-care, caring for an infant who has a colic can be exhausting and stressful, even for experienced parents. The following strategies can help you take care of yourself and get the support you need. Take a break. Take turns with your spouse or partner, or ask a friend to take over for a while, especially when the baby is crying. Give yourself an opportunity to get out of the house if possible. Use the crib for a short breaks. It is okay to put your baby in the crib for a while during a crying episodes if you need to collect yourself or calm your own nerves. Express your feeling. It's normal for parents in this situation to feel helpless, depressed, guilty, or angry. Share your feeling with family members, friends, and your child's doctor. Don't judge yourself. Don't measure your success as a parent by how much your baby cries. Colic isn't a result of poor parenting, and inconsolable crying isn't a sign of your baby's rejecting you. Take care of your health. Eat healthy foods. Take time for exercise, such as a brisk daily walk. If you can, sleep when the baby sleeps, even during the day. Avoid alcohol and other drugs. Remember that infantile colic is a temporary problem. Colic episodes often improve after age 3 to 4 months. So, you should have to convince yourself it is a temporary problem that will disappear later. Have a rescue plan. If possible, make a plan with friends or relatives to step in when you are overwhelmed. If necessary, contact your healthcare provider, a local crisis intervention service, or a mental health helpline for additional support. When we see some of the pharmacological management that might help in reducing infantile colic symptoms. Overall, infantile colic is a transient problem that will disappear or subsides when the baby is around 3 to 4 months. So the best management is just giving a time. It will resolve later when the baby is around 3 to 4 months. There are some pharmacological drugs that will help the baby to have a limited amount of colic or that reduce the colic. But majority of them are herbal drugs that are not approved by FDA. The first one is simeticone. Simeticone works locally in the gut and does not get into the bloodstream. It is said to relieve abdominal pain. Typically, an infant will be given a 2.5 ml spoonful after each feed. It can be added to the infant's bottle or given directly into the mouth, either with a spoon or an oral syringe. Grape water is considered an herbal remedy. Although many parents swear by it, the FDA has not approved grape water. There is also no proof that it works to ease stomach discomfort in babies who may suffer from colic. Dicyclomine hydrochloride is an anticholinergic drug that has been proven in clinical trials to be effective in the treatment of colic. However, because of serious, although rare adverse effects such as apnea, breathing difficulty, seizure, syncope, its use cannot be recommended. So it is eradicated from the market. This is all about infantile colic. Thank you for watching.